And welcome back. So now we are going to discuss the knee joint, the most vulnerable, the poor joint in the body. Poor, it is not poor because it doesn't have any wealth. It is poor because it is stuck in between your hip and your foot, right? It doesn't do anything on its own. It is just coming in between and getting all the worst things possible. Because you want to achieve something, isn't it? Like in yoga, you want to achieve lotus pose. In other fields, like in running, you want to achieve some speed without even knowing that how your hip and how your foot are performing, isn't it? And then all the burden comes to the knee joint. So that's why we need to really keep some focus and attention on this joint so that it doesn't get any pain or trouble. Because you will see in the world, after lower back pain, there are a lot of cases of knee pain. Isn't it? Very important. So keep some focus here. So when we talk about the anatomy of the knee joint, it is combination of your femur and the tibia. So femur and the tibia. So this is your fibula hanging to the side, enjoying its life. Right? So this is your femur, this is your tibia together. Move them away, knees liberated, just like your shoulder, isn't it? Just like your elbow, right? So what we need to do here, if you will see in this knee joint, there are small ligaments from all the sides. This ligament is broken, sorry, it's already gone. So one ligament is here, one is here, one is behind the posterior ligament, and then anterior ligament, which you can see right in the front, tiny one here, ACL, right? This is ACL, guys. Normally gets broken all the time in the sport, in yoga also, slowly and gradually with your practice, right? But in the sport like football or any contact sport or maybe impact sport, it gets broken very easily, right? ACL. So what these joints are doing basically, what these ligaments are doing basically, from all the sides, they are just trying to keep these two bones together. That's it. They don't want it to move anywhere else. They just want it to move in its own specific direction, which is flexion, extension, flexion, extension. This is the primary movement of the knee joint. It's like elbow, flexion, extension. But there is small difference than elbow. That knee joint is also having a little bit on the lower leg, lower area. Once it is flexed, it can give you lateral and the medial movement of the lower limb. Okay, we also call it medial and the lateral rotation of the knee joint. Okay, but again, just like any other mobility in any other joint, it is different. It is completely different in different people, right? Some people, again, in yoga, you will find doing a lot of vigorous type of movements, like moving leg all the way up, doing namaskar here with the feet, and doing all the way, sitting all the way back and down, like you have this picture in your manual. You can see that picture. There is extreme external rotation and extreme internal rotation on the tibia. We also call it knee internal and external rotation. Okay, extreme. But again, very limited number of people like that, 5-10%. You're not one of them. Don't worry about it. You don't need to follow it. Okay, you will still get liberated without breaking your knees. So don't worry about it. Easy, chill, just follow this. Okay, so here, if you will see this, in between, if I'll just remove it, you will see this is called, right here, the nesting ball. Can you see the nesting ball? We call it meniscus. Okay, have you ever heard of meniscus tear? So this is the meniscus. It gets tear. Why? Why it gets tear? Because there is a lot of load from the top. So just imagine the entire body, entire upper body is here. Whole leg, pelvic, your lower back, your belly, your chest, your head, and everything. The whole load is coming here on top. And if muscles are not strong, surrounded muscles are not strong, these will create a lot of pressure on this area. And just imagine with this pressure, you're moving as well. What will happen? You will create a lot of friction. You will create a lot of force into this area, and you will keep on ripping it off slowly and gradually. And that is why muscle control is needed. That is what you are learning in the course. The muscle control, moving with muscle control keeps the joints health. And that's what you have learned, how it happens, right? Got it? I don't need to remind you, isn't it? In the course, you're learning everything. I'm just here just to give you a very tiny bit of anatomy. Otherwise, your mentor is doing fabulous job, tremendous job in giving you all the clarity of all the joints, how to keep them happy, healthy, isn't it? You're doing it already. Great. So make sure that your knee joint is only designed primarily for the flexion and extension. And that's why you should not be again doing hyperextension here unnecessarily, right? In front, the patella is here, which is hanging on the tendon. You will see, right? Hanging on the tendon in the front, right? So if you will see, if there will be any imbalance in the surrounding muscles, your knee gets the pain. It can be in the front, it can be behind, it can be on the either side, lateral or the medial, it can be anywhere, or maybe inside, right? And we have different codes for it. If you need to understand the knee pain, if you need to understand the correction of it, different codes. But here you will understand how not to get the pain. That is the first. Prevention is always better than cure. If you will not prevent yourself, forget about the cure, because you will not be able to get back to the at least the standard position, or maybe the position where you can at least restore your body. You won't be able to. You are again and again keep on hitting your injured foot on the wall. So what is the use of it? The banging your head on the wall again and again, I'm telling you not to bang it. And there are stitches. Again, banging your head on the wall. Will it help you? No, it won't help you. That's why prevention is better than cure. So first prevent yourself, then cure will come. Okay. So first understand the anatomy of it. You need to understand that because this also does not have any, symmetrical shape, if you will see. It doesn't have any symmetrical shape. The nesting ball are just somehow holding them, accommodating them. And then how they are moving in yoga, you will see you keep on moving how? You flex your knee and then you move yourself here and there. Now see, when you're moving, what is happening to the ligament? So what your mentor have told you about the ligament. So when you're moving your knee, so this is flexion, this is completely fine. Until here, you are okay. Okay. And after that, what you're doing? You're doing internal external rotation on the lower limb. This or this. So whenever you're doing this and this, creating a lot of shear force on the meniscus and on the tendon. And this is how I broke this tendon or this ligament. Okay, this is how, because I was doing too much of this in showing in the showing off, not the showing off, in demonstrating, right? In showing the people that how you get injured within the body. And that's how I lost one of my ligament here of this model. This is how I lost the connection of this ligament. This is how I lost the connection from this ligament. Only this ligament is holding these structures together. Otherwise, my knee will get liberated very soon. Okay. Same things are happening within your body also, guys. You don't realize it because you cannot see it, right? Because we only believe what we can see. If we cannot see, we are just living in some dream zone, dream world in our ignorance, because ignorance is bliss for us. So we are just living like that. So please don't live in ignorance. Just understand from the structure what is happening here outside. Same thing is happening within you. Simple. Okay. So whatever your mentor is telling you, please follow from right now. Okay. If you don't want any further injuries. Okay. So this is the anatomy. Don't move it unnecessarily. Your mentor will tell you the safe way to move. Okay. Until then, just keep it safe. And definitely whatever type of injuries you have got, you can definitely recover it. But first, learn the prevention. All right. Learn the prevention, learn the muscle control. You will get back. You will restore yourself. Okay. All right. Done. So please carry on with the course. I will see you next with the ankle joint.